Dr. Bert Eichold. Let's listen.
Okay.
Here we go.
Yeah, Dr. Eichold, Eichold, MD, Health Officer, Mobile County. This is an interesting patient who presented to the Mobile County Health Department with some very vague symptoms, no history of travel to endemic area where there's Ebola, but had very challenging communication issues because of the concern of not really knowing exactly what she had. It was referred for specialty care to the University Medical Center, who accepted the patient for evaluation. Because of transportation issues, ambulance was arranged, and all the fire and rescue people responded in a very appropriate manner using their biohazard equipment. We think this is a very low probability for a serious infectious disease, but we'll leave it to the specialists at USA Medical Center to determine exactly what's going on with this patient.
Well, her family has been traveling to areas where Ebola is present, isn't that correct?
No, the family members had not traveled in the past 45 days to any of the areas where Ebola is present. She had some family members who had traveled to Africa, but not in the endemic countries.
Can you confirm that a floor has been evacuated where that patient is being treated?
I do not know what's going on at USA Medical Center. I know that they were prepared to evaluate the patient, and that they have been, their infectious disease team was notified on how to properly evaluate the patient, and they're probably taking cautions, and exactly what they're doing is up to the University Medical Center.
Do you know what symptoms she said she had, and did she specifically say?
Well, HIPAA protects her for any of her health privacy, and so she had just some vague, non-specific symptoms.
Can you tell us what time she came in today?
She came in early this afternoon, so it was after the noontime hour, and was evaluated with her non-specific symptoms, and everybody wanted to be very cautious and have concerns about what might be the underlying issue, so we referred her for specialty care.
How long does it take to determine whether someone does in fact have Ebola?
Well, you know, the incubation period is 18 to 21 days, so and she's not been out of the country, and none of her immediate family have been in the endemic area for over 45 years. Haven't been in the endemic area at all, and have not traveled in over 45 days. So the incubation period would be, you know, a period of time if you were exposed, and we don't know when she might have had an opportunity to be exposed to the Ebola virus. But I think everybody is being very cautious and wants to make sure she gets the best care possible.
How do you evaluate the response, the initial response by the health department, and then I don't know if you can touch on South Alabama Medical Center?
I think everybody responded in a very appropriate manner. They used all the protective equipment. They were very professional. They got her to the location where she was to be evaluated and treated, and determined exactly what her underlying medical condition is. But again, it was a challenge taking care of this lady because of the language barriers, and even using translators, trying to ask complex medical questions can sometimes be very hard. So I think everybody did a great job, and hopefully we'll soon find out what her real underlying diagnosis is.
Will she be kept in isolation from this point on, or how is this patient being?
I don't know. I mean, I think they're evaluating. Our concern was she didn't have a fever, so that was one of the main things that everybody is concerned about from CDC. She did not come from the endemic Ebola area, and she has no intimate contacts with somebody who had been in the area for the past 21 days. So we have I think everybody's being very, very cautious, and I'm very proud of our community and how they responded and taking care of the patient.
And her family members who have traveled to Africa, none of them have shown any.
Nobody else that we have. Nobody else. The only family members who've been to Africa, to our understanding, have been over 45 days ago, and none of them were sick.
How long does it take to determine if she is affected, and what is that process like?
Well, there's several tests, and the CDC is the gold standard about blood testing, and there are different blood tests that are available, and exactly when those could be responsive or respond is variable with each individual patient.
Do we know why it took so long for her to get from the health department here to the hospital?
Well, she had at some point in time in the communication whether she really wanted to go back home and not be tested. So the arrangement had been made. So, you know, in America you have the right to you know, decide your health treatment and whether you want to be treated for a medical condition. And we were working with her to try to inform her about how important it was for her to be evaluated. And so that took a little time. So from the time transportation was arranged until she really understood and appreciated that she needed to go was somewhat challenging.
And for folks watching at home who may say this is an overreaction, what do you say to that?
No, I think this is it's an appropriate reaction. That the Mobile Fire and paramedics were not sure of exactly the underlying condition. I was in the clinical area not wearing biohazard gear today because I personally did not think there was a lot of potential risk, but I commend the Mobile Fire and Rescue for responding. The police cordoned off the area very appropriately. They took care of the patient, which is the most important issue, and I think she's receiving the proper care.
If there was a language barrier, how
you had to convince this woman to get tested?
No, we talked to her the first time, and she wanted to come by and went out when we were earlier in the afternoon, and then when the ambulance transportation was arranged, then she said, well, she wasn't sure. I think she wanted to ride in the ambulance, and again, I don't think she really maybe completely understood what an ambulance ride was like. So, you know, some issues that I think were overcome, and she's where she's supposed to be, and I think the community did a great job.
Would you say this is the first time the hospital has questioned whether or not, you know, this Ebola patients? Is this the first Ebola patient questioning of the hospital?
I don't know. I mean, the hospital, there are multiple hospitals in Mobile, and I can't tell you whether USA in their regular clinical practices have seen anybody else who may have traveled in an area that they've evaluated. So we can only comment about the patients that we see.
So you're telling me if a patient comes in that shows signs of Ebola, they have the option to go get tested or not?
Well, there's a series of what can be quarantined. It's a very good question, and in other areas like in Texas, they've gone to a judge, and if there's a real high probability, then a judge will issue an order saying that the person must be treated, evaluated, and that's how it's handled in Texas.
Can you tell us where this woman is from and talk about that language barrier again? Was it hard to communicate with her, or were you able to understand what kind of symptoms she had?
Yes, we were able to, through translators, to understand the symptoms and ask specific medical questions, and then translators would respond back. And so I think that our team did a good job trying to appreciate the underlying medical condition that she had. And it was not an emergency, but it was one that we had concerns of, and our team felt that she needed to have specialty evaluation.
How many
language?
I believe it's Swahili.
How many healthcare workers in your department came in contact with this woman?
There were a very limited number of individuals who were in contact. I can't tell you exact numbers that were in the clinical area, but people maintained a safe distance when dealing with the patient. We did not draw blood or any biological fluids from her, and she was not in acute distress in her symptoms.
What time did she arrive?
I can't tell you the exact time. It was early this afternoon, probably, you know, sometime. I can't tell you that exact time.
Was anyone else wearing the biohazard gear there? You mentioned that you did not feel the need to put that on, but were others?
No, the fire department, Mobile Fire and Rescue, responded. Nobody at the health department, you know, put on, you know, biohazard gear. You know, as they were evaluating the patient. But again, it was at a distance kind of evaluation. There was not one of these where clothes were not removed and things of that sort as we were determining what was going on with the patient. The first thing is get a history from a patient about what's going on, and then obviously after you find out some history, and from the history it was felt that she would benefit from special evaluation.
Does she live here in Mobile, or is she visiting, do you know?
I believe she lives here.
And will we have to send these tests to Washington and the CDC?
No, the CDC is located in Atlanta. So the Center for Disease Control will probably overlook, as there was an announcement today that from the CDC, Center for Disease Control and Prevention, is that they were going to evaluate all suspect cases. And so we look forward to their guidelines, and I'm sure that they will make sure that we get the appropriate tests and appropriate precautions will be taken.
Do you know if they'll do any testing locally?
I don't think so. I don't think there's a lab certified in the state of Alabama to do all the necessary testing. It's very complex testing and not done very often, so specialty labs are the ones that usually handle these kind of complex medical issues.
So the CDC has already been contacted about this possible?
I don't know whether I did not contact the CDC.
That's the hospital's job to
Well, I mean,
take a
it's
test and send the results to them and contact the CDC.
correct, and the appropriate agencies will, when the specialists make the decision, they will decide which test as they evaluate the patient, and then make the appropriate referrals as they deem necessary.
So a specialist at this hospital may decide she doesn't need to be tested for Ebola.
That could be true.
Talk about the process of disinfecting your department after this patient left.
The process is, we have, we'll probably go back and re-clean areas, and but we're not at this point in time going, I think, to a super, lockdown, tape down area. I think this is a we'll make sure that the areas are clean, and all of our staff takes necessary precautions while doing any kind of cleaning activities, because we always assume every exam room has potential for people to have viruses and other germs in any room where someone who is sick is being evaluated.
Is this the new norm now? We've had that case in Texas, the first case. Will we be seeing this all the time?
I don't think so. I think it's a case-by-case basis, and I think it's this is everybody's being very sensitive right now, and everybody wants to make sure that we do the right thing. And I don't think this is going to be an everyday occurrence, but I commend everybody and how they responded, and I commend the media for y'all's response and trying to get good information out to everybody. And we will wait for USA to tell us what the underlying medical condition of this patient is. That's why we referred her for specialty care.
Have you spoken to this woman?
Do what?
Have you spoken to this woman yourself? I mean, through a translator.
No, I was in the clinic area, but I did not talk to her specifically.
Does she seem scared?
I think there was. I think from the team's approach is that there were some issues that she was concerned with, and I think being able to communicate effectively makes somebody better understand what the process is. And I think all of us would be a little nervous if we really didn't speak the language and people wanting to send us to specialty care.
Anyone who doesn't speak English being escorted into a hospital, which by people in hazmat suits, I'm sure is a frightening experience, wouldn't you say?
I would say probably being escorted by people in hazmat suits to your car would probably be a frightening affair. So not necessarily going to the hospital. I think the whole situation was probably alarming to the individual who really doesn't effectively communicate when you see people coming up. And the fire and rescue persons did the right thing and protect themselves in order to be able to provide care to others.
When did you contact the hospital?
We contacted the hospital earlier this afternoon at around 4 o'clock.
4 o'clock. And what has been your communication with them since the patient has been brought in?
None. I just came to see you guys. She's being treated, and she's where she's supposed to be, and I want to try to get the best information out to the community so the community does not overreact in a way that where they have misinformation.
So USA knew that you were going to bring the patient here at some point today. Did you arrange a time?
Yeah, I talked to the emergency room doctor, so I can't tell you exactly what time that was, but they knew and they accepted the patient and they were going to do the evaluation. Then it became the transport issue.
So it's unclear why some of these patients that need to be seen are sitting outside waiting to be seen. The hospital could have shut down earlier if they knew a patient was coming in, right?
I do not know. I do not work at USA, and I have no knowledge. I was not here.
But you do know you arranged this earlier.
We talked to the doctor in the emergency room, and they accepted the patient to come. So what is their operating procedure? I can't tell you. It's what is your, what is...
Well, there's some folks waiting outside to be seen. That's why I asked when we got to the scene and they were turned away. That's all.
I have,
Okay.
Do you know if they had to make special precautions for this woman? And
I have not been inside. We made the evaluation, and they respond in the way that they're supposed to respond, and we apologize for any inconvenience if it's caused to the patients who are waiting to be seen at the facility.
So right now, you don't know where she is right now.
No, I left the health department to come here to talk to the media.
And again, none of your employees will need to be checked out.
I don't anticipate anything different, but we don't really know exactly what this lady has.
So if her tests come back positive for Ebola, then
I would say that there would be other tests that will be implemented, but again, this is a what I would consider a low threshold, but one that we want to be very cautious. And if we're going to err, we want to err on the side of taking care of the patient and making sure they get the best specialty care they can.
Dr. Eichold, a quick question. How long was the period between the discovery being made about the patient's condition and the time that she was transported to the hospital? Did that take a long time to make a decision?
No, the decision was fairly short. At first, the decision was the question was how long would it be from the time the decision was to go to the hospital was somewhere around 4 o'clock this afternoon, 4:30. And then the question was how that transportation was going to be arranged. And then the ultimate decision by the team was that it would be best to transport her by ambulance to make sure that she got where she was supposed to go. It was not because of the extent of her physical condition. And then the fire and rescue made the appropriate decision to use their protective equipment. And then brought her to the hospital. So the time difference was probably, I'm not sure exactly what time it is now, but I think it's around 7 o'clock. So by the time there was a question about riding in an ambulance, and 4:30 and 7 o'clock, so a couple of hours.
But you don't know when she arrived to the health department. You don't know what time.
I don't know what time this afternoon, but it was afternoon is when she arrived.
Around 4 o'clock, you guys made a decision to contact USA.
Yeah, around 4 o'clock, contact USA for a specialty evaluation. They were willing to accept the patient to evaluate her, and then the transportation had to be sorted out, which took a little time.
Now, is this something that you've done now? You've got a protocol at this point for such an event, or is this something that's going to be refined and worked on again, or did this happen pretty good? I mean, are you happy with it?
I think there are always things can be improved upon. I think there are always challenges that you learn from the experience. So yes, there will be learning moments, and we will work together as a team to try to continue to provide high quality care to the people of this community.
I see the ambulance over there. What's going to happen to the ambulance now? It was taped up earlier.
Do what?
What's going to happen to the ambulance now since it's been taped
That's
up?
Mobile Fire and Rescue. I'll leave that to somebody else's department.
I know you've gotten a million questions at this point. I'm actually getting some texted in, as crazy as it sounds. So the question is, a lot of people tend to, the CDC is getting thousands of fake calls. I mean, across the country, this could very well easily be another fake call, but based on your impression of your interaction with the individual or their interaction with the individual, I mean, do you get the idea that this one's just crazy and just screaming Ebola just to scream Ebola, with all the media hype?
What was it? What was the exact question?
The question is this person out of their minds crazy, is what I'm asking.
Is this person crazy? I'm not a psychiatrist, so I don't feel capable of answering the question.
There are a lot of people out there who are freaking out right now. They don't know whether or not this person is legitimate or not?
I think this is a real human being who has an underlying medical problem that we're trying to find out what she really has, and we're doing it to the very best of our ability with specialty care at a University Medical Center, and I think everybody's doing a real good job in trying to take care of the patient.